Automation is powering what's possible for businesses of every size in every industry. Unlock your potential at Automate, the largest showcase of robotics and automation in North America, May 22nd through the 25th in Detroit, Michigan. With over 600 exhibitors, 200 speakers, and more than 25,000 registrants, there's no better way to power your business. Register for free at automateshow.com. That's automateshow.com.
Welcome to the Dare to Ask podcast, Season 3, Episode 1, the sports bra makeover you need.
Thousands of dollars I've spent on bras and still looking for that perfect fit.
For the rest of our lives.
Yeah.
I'm Corey Jensen, your host for this Dare to Ask podcast. I'm a mom to a big family and have delivered 5 babies. And like many women, I try to stay informed about my wellness as well as the health of my kids. We've created a space to have open conversation about what's going on with the woman's body without feeling intimidated in a clinical setting. A place to talk like girlfriends do. A space that
we're here
dares
to make
ask.
the connection, be authentic, and really get to know your provider. Yes, know the person behind the stethoscope. Dare to Ask will be where you hear the questions that we are all curious to know, but just need a space to do it. You've landed on the Dare to Ask podcast, show hosted by Corey Jensen and sponsored by Essentia Health.
Well, Season 3 is going to be packed with our biggest variety of subject matters in diverse health topics and brilliant and relatable providers. We'll be getting into mental health and sleep medicine, plus dermatology, urogynecology, vision, lactation services, and the list goes on, with an all-female cast of doctors and specialists who are going to give us some of their best in the fields that they specialize in, that are going to give us some of their best in their fields, while also inviting us into their lives. We call it Real Talk About Women's Health because we dare to ask the questions that might be slightly uncomfortable, but also very necessary in our lives. That quick intro for Season 3, but let's get you into Episode 1. Tessa Martin is an athletic trainer employed by Essentia Health. And she has a fascinating story how getting her on the sports field, in the locker rooms, helping out kids, and how that applies to her life, but also a lot of our kids' lives too. We get to find out a little bit more about Tessa and what could be one of my favorite topics to date. We're talking sports bras. Tessa says the right sports bra is incredibly important for sports, and she thinks it should be treated as protective equipment, much like jock straps are. But what if you're not an athlete? No problem. This is for all of us, because if you have breasts, you must have the right fit in your bra. And that, of course, by extension, goes right into the sports bra world too. The importance of finding the right sports bra can be confusing and challenging, not to mention expensive. So we're bringing you the life hack when it comes to getting a sports bra that's good for you, like so good, you might even forget you're wearing a bra. That's saying something. Let's get to it.
I have to ask, what's your favorite sport?
Probably volleyball.
Volleyball.
Yeah, I still attempt to play volleyball now. I'm in a women's league, so.
Nice. Any professional sports do you watch? Do you have a team?
It's kind of bummed me out that, North Dakota doesn't have any professional teams. I've never really clung to any specific professional team. I lived in Oregon for my grad school, and they don't have a professional, football team anyway. And then I lived in New York. I thought about being a Jets fan, and then that just didn't really stick.
And you're like, ew, the Jets.
Yeah, exactly. So I just, I like playoffs. Just good games.
Right. That's when the vibe is happening.
Yeah.
How about Olympics?
I was obsessed with figure skating and Kristi Yamaguchi.
Yes.
And then, the whole Tanya Harding, Nancy Kerrigan thing. I mean, I was all about it.
With my cousins, and it wasn't on an ice rink, but we would choreograph ice skating routines together and pretend we were ice skating. And that was all during that era.
Yes.
Had the fever so bad.
Exactly. Yeah. I haven't ice ice skated in 30 years. So I have I'm good at rollerblading. So I feel like I could probably do it,
It's more intimidating for me, the falling. That took a turn.
Yeah, it did.
Okay. I love to find out about you as a person, your family. Tell me a little bit about yourself.
Sure. So as I said, I'm an athletic training supervisor for Essentia Health. I've been with Essentia for 8 years now. Prior to that, I lived in New York for 4 years, and I worked at a Division I college out there. Okay. And then before that, I lived in Oregon for 2 years. I went to the University of Oregon for my graduate school, DSU. So I'm a Bison alum.
What about families? Where are you from? Where did you grow up?
So I'm from the Minot area.
Okay.
Surrey High School is where I graduated high school from. My parents moved to West Fargo a while ago. So my sister lives in Fargo. I'm not married. 2 dogs. So my family's mostly in the Fargo-Moorhead area.
You have family from around here.
Yeah.
That's so great.
Yes.
So you said 8 years here?
Yes.
With
Since I've been
Essentia.
back. Yep. Mm-hmm.
Okay.
Yep.
You have, a title to go along with.
I'm an athletic training supervisor, but I still work as an athletic trainer. So I work at Cheyenne High School. Every day is kind of different. We're there for any athletic events after school. We cover practices. We get kids ready to go to practice. We do rehabs. If injuries occur, we're there to evaluate them and make appropriate referrals if necessary. We cover all the sporting events. It's not your typical 8 to 5, some weekends.
It's very much you're on an athlete's schedule.
Yes.
So, or a coach's schedule is kind of how it plays out. Do you like that schedule?
I think for yes and no. I am not a morning person, so I appreciate being able to sleep in a bit and just kind of get stuff done earlier in the day and then head to work. Weekends can be tough. A lot of my friends don't like my schedule.
Cancels out some happy hour.
Yeah. For myself, I think it works for me. I don't think that it would necessarly work for a lot of people.
Is taping ankles even a thing anymore? I immediately
It is.
How many ankles do you tape a day?
I actually get asked that a lot. How much tape do you go through? I don't know. I don't tally it, but a decent amount depending on the sport. We do tape a lot of ankles, after an injury. I don't love it for prevention because exercise is to strengthen instead. Let's rehabilitate that.
Otherwise, we're just allowing it. We're saying, go ahead, stay weak, little ankle.
Exactly.
Don't actually fully recover.
You're not going to have an athletic trainer available to you 24/7. If you just want to go play pickup basketball, you should probably have strong ankles. So.
Yes. This was enlightening for me. This year, I started working with a corrective strength trainer, personal trainer.
Okay.
Whole assessment before we ever started working out, and she was doing all my intake and all of this, and it was one of the most extensive I'd ever had done. I just absolutely adore her and really wanting to, get involved in her clients' lives and understand some of those old injuries.
Yes.
What are weaknesses? Caring for your body the appropriate way. I have herniated low back discs, and from an old ankle injury from high school playing sports that I never officially rehabbed. Never been corrected.
Yep.
It's always been weak. And it was like the biggest mic drop of my adult physical life.
Yeah.
Wow, we really have to kind of go back to way basics here.
The beginning.
Yes.
I think one of my biggest takeaways from graduate school was pain is not necessarily the problem or the issue. It's a symptom. Just because you have, knee pain doesn't mean the knee is the issue. It could be your hips. It could be you have a weak core. It could be, foot problems. I really try to do, full assessments, functional movement assessments, watching somebody walk, watching them walk barefoot, watching them run, and just seeing those biomechanics. And okay, I can see that you're externally rotating this area more than the other side, or you're not symmetrical.
Yes. And I just feel like in my generation, when I was growing up, that was not a thing. Like your best friend's dad was the coach of this.
Yep.
Kind of learned how to tape an ankle, and that's about as maybe you took an ice bath. That was about it. In exciting times, at least for our young athletes, hopefully not to have lifetime injuries or things that they're going to regret they ever tried or did when they're 40.
I always try to educate my athletes, and they probably get so sick of hearing my voice.
You know what? Teenagers are just like mom.
I won't take it personally.
Do not take it personally. I promise you, some of that's going to stick, and then they're going to remember you in 25, 30 years and go, that Tessa Martin, I'm so glad she always made me do X, Y, Z.
I will say that is one of the things I love about my job is, with other healthcare professions, they see their patient once and then sometimes never again, or they see them, once a month or, a couple times a week. I get to see my patients every single day. Yeah. A lot of times I'm there when the injury happens.
Sure.
So
giving this 360 if you witnessed an injury happening.
I'm with them throughout the entire process, and then I get to see them turn back to sport. And it's a really cool part of my job. Again, I see these kids that graduated, and I'm actually in a wedding in May from one of my former athletes from when she was a collegiate athlete. Right. So you really build these relationships with your patients. And I think that's something that's really unique about our profession.
What made you get into the level you are? College experience and when you finally decided to hone in.
High school, I sustained an injury. I feel like a lot of athletic trainers probably have a similar story.
Injury nucleus?
Yes, yes. Everybody got hurt playing a sport. And I didn't have an athletic trainer at my high school. We just kind of had some outreach for games and things like that. I got hurt, and the athletic trainer was, evaluating me and taping my ankle. And I was like, oh, taping looks fun. I could do taping and athletic training, you get to watch sports. So that was kind of where, the seed was planted. When I went to college, I started out biology major, wanted to do healthcare, wasn't really completely sure of what I wanted to do. But I decided I went to NDSU and they had an athletic training program. So I talked to the program director and decided, I'm going to do this. I wanted to do collegiate. I wanted that high caliber athlete, really focused in certain sports. I moved to New York, worked at a small D1 college out there, and I burnt out. Our games were Saturday, Sunday. Every weekend, you were either covering at home or you're traveling with the team. Yeah. You'd maybe have Mondays off if you were lucky. And then you spend that day running errands, doing laundry. It was fun. I loved the athletes. I loved that level of competition.
I'm sure even the level of what you were learning, too.
Yeah.
Like that experience.
Oh, yeah. I think I could be a coach.
Yeah.
I'm sure every coach would love hearing me say that. Oh, okay. Felt like I was part of the team. You're on the bench with them. You're watching these close games, and it's emotional. Yeah. Being a part of, somebody's comeback story was, it's a very cool feeling. Even at that level too, I think you see kind of the ugly side of athletics, behavior that is not really acceptable anywhere else. That kind of wore on me as well. So I decided I'm not an East Coaster. I mean, everybody there was like, you're from North Dakota? People live in North Dakota? Yeah, we even have paved roads and electricity. It's wild. For me, I missed my family. I'd been away for about 6 years, and my sister was pregnant with her first child. That was something that was really motivating. Oh, God. Sure. I love those kids.
I want to be an auntie.
I mean, she told me she was pregnant, and I didn't believe her. They FaceTimed me, and they're just not kid people. So I was like, this isn't funny. Don't joke around about this. I started crying. I'm like, it's not funny. They actually were having a baby. So, I mean, that was a huge motivating factor for me. Thought about a career change. It was just a burnout. I was tired of working every single day, long hours, and sometimes it's a thankless job. So for me, I was really considering a career change.
Stopped you from doing that, making that career change? A job. The geography. Well, so I thought about,
PA school, specifically UND, just, for location, and their program was centered more just you learn on the go, you learn on the job. You find a preceptor and you shadow them basically. And I could not find a preceptor. I was living in New York at the time. So when I was kind of going through this process of applying for, I couldn't find a preceptor. So I was kind of like, well, I guess we'll put that on hold. I moved back without a job lined up. And so then my sister she emailed me a job posting at Essentia. I applied, I interviewed, and they offered me the job that day. So, oh my goodness. I love Fargo. Yeah. Community really wants to be community, and also just that great area for family. For sure. And you get that vibe. And okay, so you're back at Essentia, and what are you doing? When I first got the job, athletic trainer, I had no idea if it was for a clinical position or a school outreach for Barnesville High School for 4 years at Barnesville. Nice. And then Essentia won the West Fargo district contract, becoming a team lead and kind of taking over that West Fargo district area. I struggled because I loved working out of Barnesville. Yeah, again, you become part of the community and you get to know all those kids' families, the coaches you become close with, and you become friends. I struggled, and it was really just kind of that step up into a leadership position that was really the draw for me. Sometimes in this career, it can be hard to move up. Yeah. So when those opportunities present themselves, you kind of have to go for it. I took that position 4 years ago.
So you greenlit it.
Yes.
I'm going for it.
Yeah, I said, all right, let's do this. It's a bigger school, so I was a little bit nervous about that. It's been great at Cheyenne. Coaches are great. The staff and the level of support there is really, it's great.
The programs are
that really helps.
High level too.
I will say it helps when you have successful programs.
Sure.
It makes your job a lot easier.
Well, as you know, being a NDSU undergrad, it's always nice to root for the winners.
Yes. Watching bad sports it's not a fun thing.
No, it's difficult.
I've been lucky with the programs that I've worked with because Barnesville, they were very successful in their athletics as well.
Like a rabbit's foot. You got a lucky rabbit's foot. Where you go?
Maybe it's me. I don't know. Maybe I bring success to all these programs.
I like that idea.
I'm just gonna tell myself that every day I wake up. It's my new affirmation.
You have a fun journey. What does the future look like? And maybe if it isn't professionally, is it personally? What is your 5-year plan?
There are days, especially November, football season, depending on how successful you are, it runs into November. In Fargo, North Dakota can be pretty cold. Yeah. And there are days where I'm outside and it's snowing or it's windy or it's raining and why did I choose this? Think about, will I be a 60-year-old woman running out onto the football field, assessing injuries? And maybe I have to say right now in my current position, I really enjoy my job. I enjoy the relationships that I've built. So yeah, that's a really great question. Potentially, a management position, but then I think about, I'm not going to have those relationships with those high school kids. I love having conversations with them and talking about what their plans are for after high school, whether that's college or not. I love being a part of that conversation, and I'm excited they're so young, and they have, if I can offer any sort of advice or anything to them, just based off of the experiences that I've had, I love doing that. Yeah. We have a class at Cheyenne where it's prevention and care in athletic injuries. So we actually have students in that class that they can choose to do an observation with us, come to a game, watch us kind of work. And I've had a couple of games where they've had some excitement. I love being a part of that conversation. Great opportunity this year, being an adjunct instructor at NDSU for their athletic training program.
You're a busy lady.
I am. If I can share, my experiences and that they can, make better decisions or at least give them as much information as possible to make the best decision for them.
You're where you're supposed to be.
I think so. It does feel
like new things when they come around.
Yes, I don't want to jinx it, but I'm actually really happy with my life choices so far.
I love that. Now, you said you have a couple fur babies.
I do. I don't know. I kind of have impulse not purchases, but I can tend to do things impulsively. My aunt, she contacted me. I had just bought my first house, and she contacted me. She was sending me pictures of this random dog, and I was like, "Oh, great, you got a dog? She's so cute," and whatever. She's like, "Oh, I wish," but so then that was kind of a red flag. Like, okay, why are you sending me and nobody else in the family pictures of this dog that you have? And my cousins, they had found this dog kind of roaming the streets in Arizona, little furball. She's 10 pounds. They weren't really interested in having a small dog or a small pet. They had small kids at the time. Okay, I'll take her, and best decision ever. Aww. She's the sweetest thing. And then one day I get a random FaceTime from my sister and her coworker, who was a friend, and they were working, and they were actually looking at different shelters and looking at dogs and things. And they sent me a picture of this dog with the biggest ears and just like such a sweetie pie. And again, literally, they sent that to me, and I called them up that day and said, I want this dog. They're amazing. Pepper and Gus Gus.
Oh, cute.
Yeah. It's funny. I didn't name either one of them. I just kept their names from what they were, but
it just works.
Yeah, Gus Gus. He came from a litter where they named them all Disney characters. So
I totally saw. I sniffed that out.
I don't know. For the people who don't know, it's Cinderella, the fat mouse. His name is Gus Gus.
There's a plug for Disney. They need another one.
Right. They could use a little help.
You're a dog mommy.
I'm a dog mom, yes. I'm a little worried about becoming a cat lady, as I'm getting older and I'm single. So I didn't want to be the cat lady down the street. But I have nothing against cats. I feel like they're, it's a great pet to have if you're gone a lot. But yes, I've never grew up with cats.
Sure. So you don't have to make your case for why.
Yeah, I don't want to anger anyone, offend anyone. Cats are fantastic. They're great.
You're equal opportunity.
Yes, animals are amazing. We don't deserve them.
Isn't that true?
Yes.
Okay, so I thought that this was first in Dare to Ask podcast history.
Yes.
You came in today with a topic in mind to talk about.
I did.
And it couldn't be more perfect and spot on. Lay it on us.
All right. What about sports bras? That is what I'm going to talk about, because just sports bras, but bras in general are not discussed very often. Research and just articles and things like that. 85 to 100% of women are wearing the wrong bra size.
Preach. That in and of itself.
Yes.
Jarring.
Yes. Women make up half the population, so
take better care of our girls.
Yes.
And the comfort.
I know. How often do you hear first thing a woman does when they get home is immediately take their bra off? It's uncomfortable.
Yeah.
For active women, 44 to 72% experience some sort of breast discomfort or breast pain. It's a leading cause to why women don't participate in sports or they stop. You know, again, my body has changed a lot from when I was in high school. Back in high school, really the standard bra that you saw for sports bras were just your typical compression bra. You just squeeze them in towards your body.
Yep.
And
that was it.
That was all that I knew.
Buy a white one or a black one.
Yes.
It was basically a glorified camisole shelf bra.
Absolutely.
Like tighter.
Yep. And, for some women, that's adequate. But as I was more active in sports, and then when I moved to Oregon and I worked with those athletes, high Division I school, several of the female athletes that I worked with, they had to wear 2 bras because they didn't have enough support. They had pain.
Yeah.
And again, research shows that excessive breast motion or movement, it can affect your biomechanics. So it can change the way you run or participate in a sport. For elite female athletes, 29% of them feel that it affects their performance. 29% are saying, I can't perform 100% of my ability because of the hindrance of their breasts.
Yeah.
For me, the fact that there's such a high percentage of women who aren't participating in a sport that they otherwise would, it's really sad.
It'll be as simple as, I don't run because.
Right.
Or want to fill in the blank.
There's multiple reasons I don't run.
But that one's actually pretty low on my list, only because I hate and loathe running.
But I'm going to use that as an excuse. I mean, it's there in my back pocket. It's something that so many women experience, but nobody talks about it.
Yeah. Okay, so we know that we're probably wearing the wrong bra, but probably most definitely also wearing the wrong sports bra.
Yep.
So since this is honed in, Tessa, what do we do?
Talk to all the women in my life and ask them, what are things that you hate about sports bras, or what are things that you look for in a sports bra? People complained about where, their straps digging into their shoulders. For some of my smaller breasted cohorts, the compression bras just making them look flat chested or, looking like a boy. Price is obviously a huge factor in the type of bra that women purchase, because again, the more bells and whistles, the more expensive they're going to be. It's funny, a little history of the sports bra. So sports bras were not invented until 1977.
Goodness.
That is 45 years. 3 women got together and they decided to sew 2 jock straps together. And they tested it out on a run, and that is the first sports bra.
Wow.
They called it the jock bra. And then they changed it to the jog bra because there were certain stores that wouldn't. Sure. They didn't want to market a jock bra. They felt that was inappropriate. So and since 1977, it's grown into a $9 billion industry, and that's just sports bras.
Yeah.
Bras they're projected to be $38 billion in 2026.
Yeah.
So, there's a huge market for, women's, not only just bras, but just athleisure wear is becoming more of a thing. So it makes sense that these companies are starting to kind of, hey, we can make a lot of money off of this. Women are wanting to participate in sports, since Title IX came out in 1972. I mean, more and more girls and women are participating in sports, which is awesome. It's amazing. So yeah, there's definitely a need. There's money to be made. I'm thinking about just quitting my job and creating the perfect sports bra and, living off of that for the rest of my life. But so again, I was looking at different research out there on what makes a really good sports bra. And again, it's hard because every woman's body is so different.
Yeah, and you have a lot of things to take into account. I think I even go back to watching, remember when Oprah used to be on? I think she was one of the first ones that's like, ladies, you're wearing the wrong bra size. And here's how you actually measure your breasts. And I remember that being revolutionary.
Yes.
And it changed how you went into your Victoria's Secrets, your Macy's, your wherever where you could get an actual measurement of your breasts.
And I would highly recommend that you should really at least, once a year, once every couple of years, go in and get measured by a professional.
I'm glad you said that too, because you think, okay, well, the scale hasn't changed. I'm still wearing the same shirt size. Right. But here's the thing. Yeah. Those girls, they go through changes too.
They do.
Age,
yes.
Babies. Hormones. There's so many things that can change.
So many things. So you could even have, the same cup size as somebody else, but, you might have a wider chest or your rib cage is shorter. So many different factors. But there was a study that they tested out 98 different sports bras.
Ooh.
I think about the hundreds and probably thousands of dollars I've spent on bras and still looking for that perfect fit.
Probably for the rest of our lives.
Yeah. So this study, each sports bra was tested out by at least 12 participants. And they looked at size of the breast. They looked at 34Bs and 34Ds. So they kind of had your smaller and a little bit of a larger size. Now, mind you, there are many women who are larger than that and,
and smaller than that.
So sports bras can be categorized into, there's low, medium, and high support. When you're looking at those types of categories, it's the research and the way that they determine whether a bra is a high support bra is they look at breast motion reduction. So the higher that percentage is, the more supportive that bra is. The best bra motion reduction of 74%, which was pretty high. And there's different types of bras. There's the compression bra, which I think when you think of a sports bra, that's the type of bra you think of. It's just pull it over your head. It's stretchy. It just basically, it pushes your breasts into your body.
As if you were to take that same ankle wrapping tape that we talked about earlier in the podcast and just wrapped it around your chest. Bound it down.
Push the breasts into the body, and that's your compression bra. There's an encapsulated bra. So that's each breast has its own space, cocooned, if you will.
A little more like your normal bra.
Exactly. And then there's a combination bra where it incorporates an encapsulation as well as a compression component. In looking at all these different types of sports bras, they found that the best bra was combination style. It had an underwire. It was adjustable. So the straps were adjustable as well as the underband. There was a way to adjust that as well. The shoulder straps, like different types, there's racer back, cross back, and just vertical. And they found that the cross back shoulder straps were the most supportive.
Okay.
Nylon was the principal fiber content. The material is very important as well.
From breathability and temperature and sweating, so many factors.
Yeah, and just rubbing against the skin. It wasn't 100% nylon, but that was the leading fiber content. Cup padding, there were pads in there. That was another complaint that a lot of my friends had, were the removable cups. You wash it and then they're...
What a nightmare.
I have that complaint about bikini tops as well. I'm like, sew it in.
Okay, so my left side looks like a big crease in it. My right side looks totally normal.
Yes.
Awesome.
Yeah, I'm like, why are there all these wrinkles? Yeah. They had cup padding. It had a hook and eye underband closure. That was the best, highest supporting bra, had those characteristics in them.
Yeah.
So I would say, if you're a larger breasted woman or just even an older woman, because again, with age, our skin loses its elasticity, and that is the main thing that really supports our breast tissue is the skin.
Yeah.
Just that type of a bra where it's kind of a combination, not your compression bra. Adjustable straps and enclosures are going to be key.
This is awesome. Some of my favorite sports bras have many, if not all of those components.
Yep.
I'm more of a racerback. That's my personal instead of cross. I do have a couple cross, but my complaint about the cross sports bra is taking the darn thing off when I'm a sweaty mess.
Yes.
I feel like I'm trapped.
All women know what you're talking about. Men, they're listening to this, they're going to be like, oh, wow. Like, I had no idea.
Oh, yeah.
They have no idea what women go through.
No. Not when it comes to this stuff, especially.
I think problem is that women, we suffer in silence.
Yeah.
I'm hoping that, with this podcast, that women are more open about the struggles that they have. Nobody talks about it. So I think just having the discussion and being able to talk to your friends or your family members about different types of sports bras, what worked for them. And if you're somebody who suffers from exercise-induced breast pain, or you have a lot of movement in your breasts when you're working out, having either a combination or encapsulated bra, so it's going to look a little bit more like a regular bra. Having straps that are adjustable, as well as the underband, being able to adjust that. They found that cross back or a racer back are going to be a little bit more supportive than just your vertical. Just having a nylon material. And again, I feel like the material is going to be very based on what you find to be comfortable.
Yeah. And for the most part, nylon's already in.
Yes.
They've already figured that out in the industry of sports bras.
I mean,
that's in the majority anyway.
Be nylon or polyester, really. That's what they found to be the most supportive.
And, I guess what I have seen, if I'm finding a sports bra where like, wow, that's all it costs.
Look at reviews.
Look at the review, but also maybe look at that, what is this made of? That could be like the cute sports bra you just wear. Maybe not you're actually using it to work out.
Yes. And there's different sports bras for different activities. Yes. So if you're somebody who your activity is, I just like to walk, then you can have a lower support type of bra. A compression bra might be the most comfortable for you.
That's true. Very low impact with yoga. Or comfortable. I want to wear a sports bra at night when I'm in bed too.
Yes, yeah.
Because you see those studies too.
Sad the things we as women go through.
What? Another wrinkle to worry? It's kind of like walking down the cereal aisle. It overwhelms you.
I went down a rabbit hole. Again, price varied a lot with these bras. So, I mean, you could spend, $25 or, over $100. Yeah. So, that obviously plays a factor. I think there are some affordable bras that are supportive.
For me personally, I'm not spending over $100 on my sports bras. I'm trying to find something affordable. And when I find one I like, then I go back and get as many as I possibly can.
If you do look at the material and things like that, it breaks down after a single wash. So that's also another thing you got to think about. Like, this bra might be a little bit more expensive, but if you look at how long they last, that's also, you got to think about that. You got to think about
There's so many things we have to think about.
I know.
It's true.
It's exhausting.
I know.
It's so hard being a woman.
It is. Then we have to talk about our nipples and if they're rubbing on a material when you're being active.
Yes.
Also, I don't like nipping out, so I want a little bit of a coverage.
And that's a lot of women.
And it's so many women. And so I love the removables because I'll do that and launder them separately like I would my normal bras or hand wash so they don't get the creases. But then if I have ones that aren't removable, you pull it out of the dryer. Now it's full of wrinkles and creases. And I want to throw it away.
Why is it folded?
I'm hoping every single woman who listens is nodding her head.
They are.
When it comes to sports bras.
And there's sports bras that, they have zip enclosures in the front. There's a lot of shoulder movement in applying a bra if it's a back enclosure. Yeah. Again, assessing an athlete who's having shoulder pain, I'll ask them things like, does it hurt for you to hook or unhook your bra?
Yeah.
I know they ask that in the clinic a lot. What motions bother it? And there's a lot of rotation that you have to be able to do in order to just put a bra on.
It's true.
So, if you're somebody who has some rotator cuff pain or
issues, all of those things.
There are bras, sports bras that hook in the front and they have a zipper enclosure. I had a bad experience with one. I was playing volleyball and it felt it go. The zipper just I don't want to say exploded. That sounds a little dramatic. But
you didn't have
immediately. I was like, my friends circle around me and we had to quick. That can be a concern with the zipper front closure, but it's come a long way since, sewing 2 jock straps together.
Boy, hasn't it.
There's actually smart bras out there where there's technology in the bra that supposedly will detect your heart rate.
We have jewelry now that does that.
Exactly.
We're looking for all the smart things.
It's a moneymaker, right? Yeah. Women are buying these products. Yeah, right. Let's talk about the makeup industry.
I'm going to make it really good, but not too good, so they only buy one.
Yeah, exactly. Yeah, it's like a fine line, right? Yeah, there's a lot of options out there. I think it's going to get better and better as, this is becoming more of a need, as more women are participating in sports, which is an amazing thing. Women are being more active, and hopefully, with some of this education, women who weren't participating in things because of there are options, they're out.
Tessa, you have given us such great information today, and you've been such a treat on the show. I'm sure I'm going to have to ask you back because we can talk about foot support.
Yeah, menstrual cycles.
Oh my gosh. Yes, we didn't even bring up sport tampons, and I wanted to. It is the Dare to Ask podcast. We don't shy away from topics around here.
That is fantastic. Sports bras should really be treated as a type of protective equipment in sports.
Absolutely right.
I mean, there's jock straps for boys. I mean, it is something that is incredibly important. It matters, and it's something women deal with. So,
yeah. Tessa, thank you so much for your time.
Yeah, no problem.
I mean, I feel confident in my sports bra shopping now. What's coming up next? Well, we've got a whole season that awaits, and don't forget, every Tuesday, we drop a new episode. Thanks for joining us on the Dare to Ask podcast. We'll see you next week.
The information contained in this podcast is not intended to be a substitute for personalized professional medical advice, diagnosis, or treatment. The information is general in nature. If you have questions or concerns, please contact your provider.
Loading the kids in the car, brokering peace in the back seat, mastering the snack handoff without even looking. Why are simple things sometimes so complicated? Thankfully, with auto owners, insurance doesn't have to be one of them. We work with independent agents who live in your community, know you by name, and answer when you call. They keep insurance simple, so you can worry about more important things, like figuring out what's growing in that cup holder. That's simple human sense. Ask your independent agent if auto owners make sense for you.